Hello, my name is Cassandra Ruth. I am a student at Alleghany College of Maryland. I'm in the LPN-ADN online program, and today is November 10th, 2025, and I'll be performing the discharge of teaching instructions to my patient whose name is JD. I'll be starting as if I'm entering the room. Come in. Hi, my name is Cassandra, and I'm going to be your nurse today. Can I have your name and date of birth? Check that against your wristband. Perfect. Alrighty, so I have your discharge instructions here that I'm going to go over with you. I'm going to go over your 2 home meds and then the 3 meds that we're newly prescribing you today, okay? Alrighty. So the first medication that we have is Synthroid 100 mcgs daily by mouth. So this medication is a thyroid supplement. You have hypothyroidism, which means that your body isn't producing enough of the thyroid hormone. This medication is a supplement to replace that hormone. It is important to watch for symptoms of hyperthyroidism, which can happen if the dose becomes too high. Some signs of hyperthyroidism to report to your doctor would be chest pain, your heart beating fast in your chest, sweating, cramping in your stomach, diarrhea, vomiting, headaches, feeling irritable, tremors, weight loss, or if you're having a hard time sleeping. You want to take this medication on an empty stomach about 30 to 60 minutes before breakfast, which includes food and medications, with a full glass of water. You want to take this around the same time each morning. If you miss a dose, as soon as you remember, you want to go ahead and take it. Do not skip taking this medication without consulting your doctor. This medication is going to be needed for the rest of your life because it is supplementing that hormone that your body is not producing enough of. Do not take any antacids such as Tums, iron, or calcium supplements within 4 hours of taking this medication. You will need regular labs drawn as directed by your doctor to monitor the medication dose, just to make sure it's doing what it's supposed to do for your body to help keep those symptoms of hypothyroidism at bay. The goal of this medicine is to normalize your hormone levels and to improve those symptoms. The next medication that you're already taking at home is the Protonix 40 milligrams by mouth daily. This medication is used to decrease your symptoms of GERD, which includes that feeling of heartburn. The acid in your stomach is what causes those symptoms. This medication decreases the acid. It is important to tell your doctor immediately if you have any symptoms such as fever, joint pain, redness on your skin, or a rash, feeling itchy, facial swelling, sores in your mouth, increased thirst, increased urination, increased hunger, headache, diarrhea, or blood in your bowel movements or vomit. This can look like a black stool. Like if you notice that your stools are looking very dark, that might be something that you want to bring up to your doctor. You may need periodic lab testings just to make sure that the medication is doing well with all the rest of the organs in your body, the systems in your body. You're going to want to avoid alcohol, aspirin, and ibuprofen. The goal of the medication is to decrease your feelings of heartburn and pain in your stomach. So then we have 3 new medications here. The first one is Lopressor 15 milligrams by mouth daily. This medication is to help with your high blood pressure. This medication just decreases your blood pressure and heart rate. Some symptoms that you're going to want to tell your doctor about includes rash, blurred vision, low blood pressure, changes in your blood sugar, fatigue, weakness, feelings of nervousness, any changes in your breathing, anxiety, depression, and changes in your mental status. So if you start to feel cloudy or just a little bit off, you're going to want to bring that up. Dry mouth and a low heart rate. You'll want to have your heart rate and blood pressure checked during this medication. You're going to want to check your heart rate daily, and you can do that by taking your 2 fingers and placing them right here on your wrist, feeling the pulsation, and then counting it for 1 full minute, and that will give you your pulse. Do not take the medication if the heart rate falls below the 60 beats per minute. So if you count it for 1 minute, it's 54, you don't want to take the medication that day, and you want to contact your doctor, or a blood pressure that's less than 110, or whatever the parameters are by the doctor. In this case, I'm just using that as an example, a common example. Do not skip or double up on any doses. Do not abruptly stop this medication. And you're going to want to be careful when changing positions on this medication. So when you get up in the morning, you're going to want to sit up on the side of the bed. Wait there for a few seconds. Once you start getting your bearings, like stand up. Then wait there for a few seconds. And then once you're feeling good, you can go about your day. Okay? You're going to want to do that each time you get up or move positions. Let the doctor know if you're taking any herbal supplements. Some herbal supplements can affect this medication and make it not work as good. So you're going to want to just let him know of anything like that so he can compare it and just make sure that it's compatible with the medication. You want to continue eating a healthy diet and exercising as prescribed by your doctor. The next medication is Zestril 10 milligrams by mouth daily. This medication is to help with your high blood pressure. This medication decreases your blood pressure. Some symptoms that you're going to want to tell your doctor about includes rash, chest pain, low blood pressure, erectile dysfunction, diarrhea, nausea, vomiting, hoarseness, changes in breathing, fever, cough, and then lip, throat, and mouth swelling. If you notice any sort of lip, mouth, or throat swelling, this type of swelling is an emergency and you need to call 911. Monitor your blood pressure weekly. You may need lab tests while taking your medication to make sure that it is working effectively with the other parts of your body. You're going to want to, again, change positions slowly with this medication. Take the medication at the same time each day and do not double up doses. Continue eating healthy and exercising as directed by the doctor. Be careful with salt substitutes when you're trying to eat healthy because they can contain a lot of potassium, which can increase your potassium level, which can cause heart rhythms if it gets too high. The last medication I have here for you is your metformin 500 milligrams by mouth daily. This medication is used to help control your blood sugar. Some symptoms you want to report to the doctor include bloating, diarrhea, nausea, vomiting, a metallic or unpleasant taste in your mouth, fatigue, weakness, sleepiness, changes in mental status. Some symptoms of low blood pressure which can occur from this medication include feeling cool, clammy, weak, dizzy, if you have tremors, if you're feeling anxious or you get a headache. Then you're going to want to check your blood sugar. If it's low, then just have a glass of orange juice or 2 to 3 teaspoons of sugar. Another suggestion that we have is that we want you to keep like a small amount of sugar on you at all times, so you can just have like a hard candy that's in your pocket or your wallet or somewhere that's with you all the time. That way, if you're feeling those symptoms, you can just pop in a hard candy, and hopefully that will help to make you feel a little bit better. When you are ill or stressed, and you start to experience any symptoms such as increased thirst, hunger, or urination, you're going to want to reach out to your doctor. This can be a sign of high blood sugar. You will need periodic lab testings to make sure the medication dose is controlling your sugar correctly. This medication is taken at the same time each day, and the goal of this medication is to stabilize blood sugar. What are the questions that you have for me today? Okay, no questions? Alrighty, well, I hope that you have a safe trip home and that you start to feel better. Here you go.